Okay, great.
Just a quick follow-on to your question. How many of you saw the news today at about 3 p.m. at Rosa? Trust me, there is some serious backdoor and smoke-filled room meetings going on right now. Pelosi staked her reputation. And whether you hate her or you have to respect the office, and you have to respect the power. And the importance of that is that over in the Senate, the Finance Committee and Baucus's committee have just put some purportedly bipartisan deals in play. Number one, not mandating the employer payments, mandating the individual pay, but not mandating the employer payments. Number two, changing the rules of the game in terms of some of the coverage and some of the more penalty issues to insurers. Okay, so the bottom line is, when you get a group as powerful and as diverse as AARP, AMA, today the U.S. Chamber of Commerce, the U.S. Chamber of Commerce, okay, the pharmaceutical manufacturers, the medical equipment manufacturers, and yes, the fringe groups, the advocacy groups for, whatever those groups are. When you have that many diverse groups, and you have politicians on record saying, I want to get this done, and when you know this is the president's primary, this is his number one domestic issue, because he feels that, the recovery's been dealt with. Anyone walking out of this room thinking, well, we're okay for now, I can take a breath. Wrong. And Mike, I would respectfully disagree. I don't think, in the current configuration that's on the table and being discussed, I don't think there are any winners. I do not think there are any winners. Not the primary care physicians, certainly not the hospitals, certainly not the payer, who I'll talk about in a minute. And frankly, we're going to victimize a couple of industries.
All right, thank you so much, Victor. Really appreciate it. And now, Dick Herman, who you just heard from. Dick, page 145, lines 15 through 17 of the House bill currently says that an employer must automatically enroll employees into the public option, no choice if they don't provide private coverage for their employees. And also, page 65 says that there will be a separate subsidized plan for government retirees and their families, which includes unions and community organizations. That's just some of the things that you can read more on those sheets that you have there. Dick, we had some good conversations prior to this because I learned a lot from him. I just want to ask you to please tell us the number one concern in all of this for small businesses. You're on.
Okay. Let me get to the specific issues of the legislation in a minute. I want to paint a real quick picture. This is very quick. Let me see a show of hands. I know some of our members are represented, and thank you for support. How many of you either employ or have employed workers in this country? Let me see a show of hands. How many of you are or have been employed? Okay. How many of you have health insurance, either currently or perhaps in retirement? How many of you have health insurance that you pay for that your employer paid at least part of? Let me see a show of those hands. Okay. And the fact is, in the United States of America, over 60% of us have our health care partially or in some cases predominantly paid by our employer. Now, there's a problem with that. What's the problem? The problem is, if I don't pay something, I don't see the bill. I don't see the whole bill. So guess what? Go ask my 20-year-old son, right? What you say, he's invincible, right? He's Hercules, okay? He thinks it costs $15 to visit the doctor. How many of you think it costs $15 to visit the doctor? and make sure that he's paying, okay? Like many, and I'm sure all or most of you, because that's why you're in this room, you're responsible for this. Right now, there are some who are unfortunate, and either they're out of work, come on, there are a lot of Americans out of work right now, or they are in whatever situation where they can. And depending on whose numbers you believe, you might hear 46 million, 1 in 6 Americans, 49 million, I think we have, you know, there are some number of uninsured. A couple quick items on that. From the point of view of the employer, we get a stake at this table. Whether Nancy wants to admit it or not, we do get a stake at this table. Why? Because we're a payer. We pay. Okay? And you might think, and again, those of you who are employers, most of this room, what's the big deal? Where does all the innovation come from? Where does all the job growth come from? Where do a lot of the paid taxes come from? And where does the right thinking in terms of responsibility and accountability for our lives come from? Small business, right? That's why you should care. A couple other first things. Victor, you mentioned the CBO, the Congressional Budget Office. The Congressional Budget Office doesn't believe we're going to cover 46 million uninsured, and it'll be deficit neutral. Okay? Guess what? Think about the statement. I'm going to make the statement again. I'm going to cover 46 million, or a large portion of 46 million, uninsured Americans who aren't paying anything right now. I'm going to cover them, okay? But it's not going to cost any more money. Now, I'm not denying savings. I'm not denying efficiencies. I'm not denying any of those things. But this defies common sense. Vote. Vote with your voice. Vote with letters. Vote with phone calls. Vote in meetings like this. Make your voices heard. Okay? We gotta get my son and that crowd into these meetings. Okay? We gotta get them into these meetings. All right. Couple more quick things. Am I doing all right on time? Wow. It is tough. Mike's right though. I like to talk. The elephant in the room. Yeah. The elephant in the room. What's the elephant in the room? Anybody?
Illegal immigration.
That's the giraffe in the room. What's the elephant in the room? Obama. This is a pretty good group. All right, Jim, your turn. Go to slide number 6. It's the one right after 5. Backward. There you go. One more. There it is. Aging. Look at these costs. I know you probably can't read these. This is medical spending. This isn't insurance. Okay. This is medical spending. Average. Centers for Medicare and Medicaid. You see the year 2006, guys. It's a lot of data. This may seem stale to you, but trust me, it hasn't changed that much in several years. Under 5 years old, $1,500 average spending per person. Under 5 to 17, $1,200. 18 to 24, $1,400. 25 to 44, $2,300. These are per capita, per person. 45 to 64, $4,864. Okay, twice as much in that bracket, from this bracket to that bracket. 64, $8,700 and beyond.